Every 40 seconds, someone in the United States has a heart attack. Shocking, isn't it? These words carry an alarming truth about a silent killer that lurks among us: myocardial infarction, more commonly known as a heart attack. Globally, heart attacks have a significant impact, affecting millions of people every year. They are not discriminatory, striking people of all ages, races, and walks of life. The prevalence of this condition is a stark reminder of its far-reaching effects on our society. So what exactly is a heart attack? In simple terms, it's a life-threatening event that occurs when blood flow to the heart muscle is blocked, usually by a buildup of fat, cholesterol, and other substances, which form a plaque in the coronary arteries. These arteries are the main highway for blood and oxygen to reach the heart. When this highway is blocked, it's like a city without power. The city in this case is your heart, and the power is the blood supply. The heart muscle cells, deprived of oxygen, begin to die. This is the grim reality of a heart attack. It's an electrical blackout in the city of your heart, one that can lead to devastating consequences if not addressed promptly. The mechanism of a heart attack is a complex process, a series of events that lead to the death of heart muscle cells. It's a battle waged within the confines of our own bodies, a fight for survival that is as silent as it is deadly. This silent killer doesn't announce its arrival. It strikes without warning, leaving in its wake a path of destruction and often irreversible damage. Yet despite its stealthy approach, there are ways to combat it, to fight back and reclaim the city that is your heart. Just like a city can't function without power, the heart can't function without blood. When this supply is cut off, the result is a heart attack. Now you might be wondering, how do doctors fight this silent killer? Imagine a battlefield with each soldier armed and ready for combat. In the fight against myocardial infarctions, our soldiers are a host of medications, each with a unique role and strategy. First, we have aspirin, the foot soldier. Aspirin's mission is to prevent blood clot formation, a key player in the onset of heart attacks. It does this by inhibiting the production of a substance called thromboxane, which encourages platelets in the blood to stick together and form clots. Next, we have nitroglycerin, the artillery. Nitroglycerin works by relaxing and widening blood vessels, reducing the heart's workload and improving blood flow to the heart muscle itself. This helps to alleviate the chest pain or angina that often accompanies a heart attack. Then we have beta blockers, the strategists of our army. Beta blockers slow down the heart rate, reduce blood pressure, and decrease the demand for oxygen by the heart. This trio of effects helps to prevent further damage to the heart muscle during a heart attack. But the battle doesn't stop with medications. There's a special force called percutaneous coronary intervention, or PCI, the elite troops of our army. PCI is a non-surgical procedure where a catheter is threaded through the blood vessels to the heart. A small balloon on the end of the catheter is then inflated to open up a blocked coronary artery, allowing blood to flow again. The quicker this procedure is done after the onset of a heart attack, the better the outcome for the patient. Each treatment is like a soldier in the battle against heart disease, each with its own role and strategy. Just like in any battle, timing, coordination, and strategy are key to winning the fight against this silent killer. But not all weapons in this war are as effective as we once thought. There are some controversial allies in this battle against heart attacks, allies that we once held in high regard. Oxygen and morphine, for instance, were once thought to be crucial tools in the management of myocardial infarctions, the technical term for heart attacks. These treatments were seen as the stalwarts, the bedrock of our therapeutic approach. But the tides of medical research are ever changing, and recent evidence does not support their use in improving survival rates. It's a stark reminder that in medicine nothing is set in stone. Old practices are constantly being challenged and reevaluated. In the war against heart disease, we must always be guided by evidence, not tradition. Now that you know the enemy and the weapons, what's next? The answer is simple: keep learning. The more you understand about myocardial infarction and its management, the better prepared you are to combat this silent killer. Knowing the signs and symptoms can make all the difference, as early detection is key. The sooner medical attention is sought, the better the prognosis. Even if you're not a healthcare professional, understanding the basics can help you recognize a potential heart attack in yourself or others. But it's not just about reacting to an attack. It's about preventing one in the first place. This includes maintaining a healthy lifestyle with balanced nutrition, regular exercise, and regular checkups. It's also about understanding your risk factors and managing them effectively, whether that's quitting smoking, controlling high blood pressure, or managing diabetes. Equipping yourself with knowledge gives you power. Power to make informed decisions, power to take control of your health, power to potentially save a life. So don't stop learning, don't stop asking questions, don't stop seeking answers. Remember, in the battle against heart disease, knowledge is your greatest ally.